So SI joints are also known as sacroiliac joints, it's an abbreviation we have, and the SI joints sit within the pelvis area, and they're these two very large joints you can see from the front of the spine, and you can see them just fractionally at the back, and they attach the sacrum, which is this area, to the two other portions of the whole pelvis area. They can give a lot of localised pain both in the front of the groin area and within the back, and they often come as part of the low back and pelvis complex. I think people are fairly amazed by how much pain SI joints can actually cause, and they can be incredibly debilitating. As well as giving you what seems like pain from the hip area into the buttocks, they can give you pain down the front of the leg and as far down the leg as the heel as a referred type of pain. So what's happening? So the joints generally will get stiff, although in some cases they can get hypermobile, but generally they will get stiff either from a fall or from some sort of activity, digging or bending generally. Sitting is also particularly bad when you cross your legs. And if you favour one leg more than the other, obviously one will be more stiff than the other. So what happens is the joint gets stiff, the local muscles get irritated, you get inflammation in that area, so that could be classed as SI joint inflammation. But the most important thing is quite a lot of pain. And then because it's not working properly, the whole pelvic complex stops working correctly. So the opposite SI joint will then try and compensate. So you can also then get pain on the opposite side, which is why people quite often say, now I've got pain in both sides. This is sort of really low in the low back and would be classed almost as pant line for people for geography points of view. So the pain is at pant line, but it can also get involved with up the lumbar area, start to irritate the facet joints of the low back, which again can be fairly debilitating. So what can a chiropractor do? Again, the joints are stiff generally, so if a stiff joint needs increased range of motion, so we would get in there and find which joint is the most restricted and increase the mobility of that joint using adjustments and mobilisation techniques. But we'd also loosen the gluteal area, which will allow more movement of that joint, and also the muscles going into the low back, and help to improve the whole flexion extension of that whole back area, thereby restoring normal lumbar lordosis and also improve the posture of the low back generally.